Anatomical directions and body planes. Abduction, movement away from the median plane around an anterior-posterior axis with the angle between the displaced parts becoming greater, as in lifting the arm sideward away from the body. Action, in physiology, the motions or functions of a part or organ of the body. Adduction, movement towards the median plane around an anterior-posterior axis with the angle between the displaced parts becoming lesser, as in bringing the arm sideward against the body. Anatomical position, the neutral stance of the individual, standing, facing forward with arms at the sides and palms facing forward. Anterior or ventral, the front of the body or body part. Circumduction, is movement around the horizontal and longitudinal axis of a joint during which the distal end of the bone circumscribes the base of an imaginary cone and proximal end forms the apex, as in swinging the arms in a circle. Depression, down, just the opposite, as in lowering the shoulder. Distal, farthest from a point of reference, opposite of proximal. Dorsiflexion, the act of drawing the toe or foot toward the dorsal aspect of the proximally conjoined body segment. Dorsal, upper surface, for example top of foot. Dorsum, the back side of the hand. Elevation, up, as in lifting the shoulder up. Eversion, turning the sole of the foot outward. Extension, is the reverse movement during which the angle between the interior aspects of the displaced parts is increased, as in moving the forearm away from the upper arm. External or peripheral, means near the surface. External rotation, turning outwardly or away from the midline of the body. Flexion, movement around a transverse axis in an anterior-posterior plane with the angle between the interior aspects of the displaced parts becoming smaller, as in bending the forearm toward the arm at the elbow, joint. Hyper, prefix, meaning too much. Hyperextension, in excess of normal extension. Hyperflexion, in excess of normal flexion. Inferior, toward the bottom of the body or body part. Insertion, muscle attachment to a bone that moves. Internal, refers to a deeper position. Internal rotation, the turning of a limb toward the midline of the body. Inversion, turning the sole of the foot inward. Lateral, away from the midline of the body. Major, means greater or larger. Medial, toward the midline of the body. Mid-sagittal or median, divides the body into equal and symmetrical right and left halves. Minor, means lesser or smaller. Origin, the fixed end or attachment of muscle. Palmar, ventral aspect of the hand, palm of the hand. Plantar, ventral aspect of the foot, sole of the foot. Plantar flexion, the act of drawing the toe or foot toward the plantar aspect of the proximally conjoined body segment. Posterior or dorsal, the back of the body or body part. Pronation, is medial rotation of the forearm as in turning the palm of the hand downward. Prone, face down, horizontal position of the body. Protraction, forward, as in bring the shoulder forward. Proximal, nearest to the point of attachment, origin or other point of reference. Range of motion, ROM, the extent to which a body part can move through all of its planes of movement. Retraction, backward, as in pulling the shoulder back and thus bringing the shoulder blades together. Superficial, toward the surface of the body. Superior, toward the top of the body or body part. Supination, is lateral rotation of the forearm, as in turning the palm of the hand upward. Supine, lying on the back face upward, opposed to prone. Valgus, position of a body part that is bent outward. Varus, position of a body part that is bent inward.